Today we will be demonstrating medication administration. I've received orders for Millie Larson, date of birth 1/1/1936. Millie has no known drug allergies. Millie is to receive haloperidol, 2 milligrams intramuscularly to control her agitation. I have here haloperidol. It comes supplied in 5 milligrams per milliliter. This is not expired. I'll do the calculations really quickly. Okay, Millie is going to receive 0.4 milliliters of haloperidol intramuscularly. The next order is for Insulin Lispro. I have Insulin Lispro. She's going to receive 10 units subcutaneously with breakfast now. The haloperidol is also ordered for now. And this is to control her blood sugar. The insulin is not expired. Insulin Lispro is not expired. And Millie is going to receive an oral tablet, Docusate, 100 milligram tablet orally now to soften her stools. I have here Docusate, 100 milligram tablet orally. This is also not expired. I'm gonna place it in the cup so that we can give that to her when we get there. Okay, so I'm gonna perform a little hand hygiene and we're gonna prepare Millie's Insulin Lispro first. And I'm gonna clean the lid. I'm selecting an insulin syringe that is not expired. Prime that a little, and I'm going to put 10 units of air into it. Uncap, coming straight out like so. And I'm going to insert into the rubber stopper, injecting that 10 units of air. I'm going to invert and turn it so that I can see the numbers. And I'm going to draw up 10 units of Insulin Lispro. There, okay. Get that remaining little air bubble out of there. I'm gonna come straight out, making sure to not bend that needle. Insulin needles are very flimsy and will bend. I'm gonna recap using the one-handed scoop method and secure that. So I have Insulin Lispro, 10 units subcutaneous. I've got 10 units drawn up. I'm going to label this syringe so that I know what it is and how much when I get to Millie's room. Larson, Insulin Lispro, 10 units before breakfast. We'll put that label on here so that when we get to her room, we have it. We'll set that to the side. I'm next gonna prepare her haloperidol. I have a clean alcohol swab. I'm gonna clean the lid again. And for this one, I've selected a 3 milliliter syringe. This is gonna go intramuscularly. And I've selected a 25 gauge 5/8 needle because of Millie's size. We've learned in previous sections that Millie is not eating well and she's relatively small and frail. We're going to drop 0.4 milliliters of air. I'm just gonna pull that down to the 4 lines, 1, 2, 3, 4. That tells me it's 0.4 milliliters. Uncap, straight out. And we're going to insert into the center of the stopper, inject the air, invert, and draw up the correct dosage. being extra careful to get rid of all the air bubbles. Okay, there we go. Alrighty, so we have 0.4 milliliters of, we're going to recap using the one-handed scoop method. And Practi-haloperidol, 2 milligrams. And we're going to label the syringe. How did I get to 0.4 milliliters? I performed some calculations off to the side that I don't know if was on camera, but the calculations were completed prior to drawing up the medicine, and I would verify those dosages with another nurse. Finally, we'll do the Practi-Docusate. We have Practi-Docusate, 100 milligram tablets orally, back into the medicine cup. Now that we've got all those prepared, we'll get some hand hygiene and we'll go down and meet with Miss Millie. Hello, how are you today? I'm Donise, I'll be your nurse. I'm going to administer some medications that the doctor had ordered for you to have now. Can you tell me your first and last name and date of birth? Millie Larson, 1136, perfect. Millie, do you have any allergies to medicines? You do not? Excellent. Alrighty, so the first thing I'm gonna give you is Practi-Docusate, and this is a oral tablet. You're going to, before I give you anything, let me do some hygiene, I apologize, and let me close this door for privacy. I apologize for not doing that step earlier. Alrighty, now that we've got that taken care of, here is your Practi-Docusate. Do you take that with water? You do? Here you go. Go ahead and take that. Excellent. Okay, good deal. So you now have taken your Practi-Docusate. Next, we're going to do your Practi-Insulin Lispro, and that is to control your blood sugar, and you're ordered to receive 10 units subcutaneously. So I have Practi-Insulin Lispro for Millie Larson, 10 units subcutaneously with breakfast. Okay, you're hungry? Me too. We'll clean my hands again before I put on gloves. And we're gonna put on some gloves. Okay. I've got some alcohol. I am going to use your abdomen to put this in, and I'm gonna go 2 inches from your navel. Okay, I'm gonna pinch because you're awful tiny, and I'm gonna clean in a circular motion. And I have here for Millie Larson, Insulin Lispro, verifying that Insulin Lispro. Yeah. And we're going to inject this into your abdomen. You're gonna feel a pinch, Millie. Are you ready? 1, 2, pinch. And we're gonna inject that 10 units. Straight out. Engage the safety. whole thing goes into the sharps box. Okay, Millie, that wasn't too bad, was it? Good. I don't see anything leaking out, so I don't think that we need to apply pressure there. Do you usually put pressure after? You don't? Okay, good. No worries. All right, the last thing we're gonna do is your Practi Haloperidol. Now this is for the agitation. I'm gonna turn you on your side, and we're gonna select your vastus lateralis site, and I'm gonna do one hand above your knee, one hand at your hip, and I'm gonna go in that imaginary box right in the center there, okay? So we'll get a clean alcohol swab. I'm gonna spread that apart there. Cleaning in a circular fashion. That alcohol's cold, I know. I thought the same thing. All right. So I have here Practi Haloperidol, 2 milligrams, and we've calculated that dose with the Practi Haloperidol, 2 milligrams, to be 0.4 milliliters. All right, Millie, you're definitely gonna feel a pinch here, and I'm still spreading very tautly, right in the center. Straight out. Engage the safety. Into the sharps box, and I'm gonna apply some gentle pressure there. You doing okay? Good. Alrighty, I'm gonna help Millie back to her back. Your breakfast should be here any minute. Do you have any questions? No? Here's your call light within reach. And clean up my mess here that I've made. Get rid of those gloves. And hygiene. Okay, Millie, your breakfast should be here any minute. You've got everything you need. Call light's in reach. Have a good day.